Hello and welcome back, Psychology 2301 students. It is Professor Medley once again. We have now made it to Chapter 15, Psychological Disorders, and Chapter 16, Therapy and Treatment. So for these two chapters, we'll be introducing you to the diagnostic manual that's used to identify various psychological disorders and talk about the criteria for identifying maladjustment or abnormal behavior, and also talk about some of the more sort of specifically the common or more intriguing psychological disorders that you've probably seen on TV or read about. And then for the therapies chapter, we're going to talk about a variety of treatments or therapies that are out there that are available to treat the range of psychological disorders or various types of maladjustment. Now, as a licensed therapist, I tend to get so excited about getting around to these two chapters because they are a big part of the work that I do on a daily basis, and really just sort of helping to inform people about psychological disorders, demystifying psychological disorders. There's a lot of misinformation out there, reducing the stigma. So for all of those reasons, I really enjoy we finally get around to these two chapters. And of course, to be honest, a lot of people, when they think of intro to psychology, they often think of the clinical part, right? People assume that it's all about being a therapist and diagnosing and treating people. As you've already found out, there's so many other areas of general psychology and psychology overall the field. So this is what I would say is a really small piece, but it is an important piece of the field. So clinical psychology, counseling psychology, they do make up a good portion of the number of psychologists overall, but even those psychologists often do work in other areas. So that's why I say it's a smaller piece than people tend to think it is, but it is an important piece. So research statistics over the last few years have shown that the prevalence of a lot of disorders is increasing, but it's hard to determine whether that's more people who actually have those disorders or just more people being diagnosed, because either the stigma for going and getting help and being diagnosed is decreasing slowly, but hopefully. Maybe it could be due to increased education overall on mental health. People are learning more. They're learning how to recognize symptoms. There may be increased access to healthcare. Definitely in a lot of places, like Texas, for example, there's increasing mental health parity, meaning many people who have insurance policies, like I have here at Tarrant County College, I am now able to go to a mental health practitioner and pay a copay that is similar to what I would pay if I saw a physical health practitioner, right? A medical doctor. And so with those kinds of things, you have more people getting help and more people essentially being diagnosed because they have access to care. So all of those are probably reasons that have contributed to these increased numbers overall. Now, in the news, those kinds of, in various types of media online, we hear cases of people just doing really horrendous things, right? Recent school shootings, mass murders, things of that sort, where people are either committing unthinkable acts, harming others, spouses killing a spouse killing their spouse. I'll get this out eventually. But also stories of people harming themselves. Those kinds of situations often bring mental health to the forefront of our minds socially about what's happening, what's going on, how do we understand it. Um, in some of those cases, we may say to ourselves, well, it's easy to identify this person, that their behavior as abnormal, right? Or that something is wrong. But it's not always as simple as we would like for it to be. In the case of someone saying they're hearing voices telling them to do something and they believe those voices are coming from a higher power, for example, should we automatically throw that out as abnormal or not acceptable without some sort of context? Eh, eh. There are lots of behaviors out there that may be outside of the range of abnormality as far as um, current social expectations. That doesn't always mean the same thing as mental illness, right? That's sort of abnormality that goes along with mental illness. So consider, for example, we're right in the middle of Pride Month, which is focused on celebrating the experiences and the gains of the LGBTQ community. Well, for almost 50 years now, right? 50 years ago, homosexuality, which technically that term isn't really used in academic fields anymore, but as it was written in the DSM, homosexuality was a diagnosable mental illness, right? So it hasn't been that long ago that it was removed from our actual diagnostic manual that professionals use to diagnose disorders. And even still, you can find people who try to engage in various reparative therapies that they believe can change a person's sexual orientation. So, our belief and understanding about what constitutes a mental illness is socially constructed, right? It changes with culture and social norms. So, I've sort of mentioned the DSM, but haven't really said what that is. So, let's talk a little bit about that. So, one ruler or thermometer measure, I don't know, that we currently use to gauge mental illness is a diagnostic tool within the psychological field called the DSM. DSM stands for Diagnostic and Statistical Manual of Mental Disorders. We're now on the 5th edition, so people will typically refer to it as the DSM-5. This manual includes a list of currently accepted, we'll call it that, currently accepted psychological disorders, their symptoms, the diagnostic criteria to help mental health professionals make determinations about whether a person has a mental illness or not. So this is a tool that's accepted specifically in the psychological field. Now, it's important to make a quick distinction that in the mental health field, we do not label people as insane. That's not what's an accepted psychological term. Insanity is technically a label that's used in the legal profession to determine a person's level of responsibility for their actions. Should a person be held accountable for their behavior, right? So an insanity label could theoretically be the difference between a person serving a prison sentence because of something they did and that person being released to the care of an inpatient facility that they have to go to for a certain period of time and have regular assessments to determine their level of mental health or mental illness, either one of those. So if a person is found to be mentally ill, they're not labeled as insane by a mental health professional. Instead, they're given an actual diagnostic label such as major depression or generalized anxiety disorder. And so I believe there's a link in the Blackboard lesson that sort of defines insanity and the difference between that and an actual mental health diagnosis. So when you hear about some of these stories that are really, sensational, there are some mental health disorders that do receive a little bit more attention than others. The sensational ones tend to receive a little bit more airtime. Unfortunately, though, the media representations that we see of mental illnesses, mental disorders, often are somewhat exaggerated for comedic effect or dramatic effect. So people who watch these movies can sometimes go away with this inaccurate view of what the symptoms actually are, or even the consequences for some of the disorders that you tend to hear about. So I'm going to talk about just a couple of those that you'll see in the chapter, and some you may see other places. I won't necessarily be able to go through all of them. So first is dissociative identity disorder. Um, there are a range of dissociative disorders. The ones we tend to hear the most about is DID, or dissociative identity. Previously, in two versions, not the last version, but the version before that of the DSM, DID was called multiple personality disorder. And so you may still hear people refer to it as multiple personality disorder. This is a disorder that really has been sensationalized, sometimes pretty inaccurately. Um, the disorder, I would say, is kind of sensational in and of itself. So, to that effect, some professionals even disagree about the credibility of the disorder. Like, is this really possible? Is this a real disorder? Are these people faking? Um, or is it, just sort of an inaccurate assessment process by the physicians or psychiatrists or psychologists who have assessed this person? So there's a lot of debate about dissociative identity. Essentially, with dissociative identity, you will find that the person, one, dissociates from reality. So they kind of have this disconnection from reality. And typically, they will have what are considered multiple identities, right? And in order to be diagnosed with this particular disorder, you actually have to have distinct disorders. There are some other categories of disorders that you're going to see within this chapter: anxiety disorders, obsessive compulsive types of disorders, which in the past fell under anxiety, post-traumatic stress disorders, which also in the past used to fall under anxiety disorders, mood disorders, schizophrenia, and then personality disorders as a separate category, and then disorders that show up in childhood or that tend to be more common in childhood. So there are other categories of disorders as well, like eating disorders, that may have already been touched on in other ways in other chapters within the textbook, um, that you won't necessarily see within the psychological disorders chapter. But if you have questions about mental health or mental illness that are not answered during the coverage of either one of these chapters, you can feel free to post your comments or questions on the message board, and I'll try to get around to answering those. Let's talk a little bit about depression and bipolar disorder. Um, Depression, for the most part, is fairly well known, right? Most people know someone who suffers from depression, either personally or kind of, I know of someone who knows of someone, or they themselves have experienced depression. Depression is often called the common cold of mental illness because it's so very common. Along with depression, which is significant periods of sadness, is also bipolar disorder. And bipolar disorder has gotten quite a bit more attention over the last 20 to 30 years, I would say. And with bipolar disorder, a person has alternating periods of depression, which is significant sadness, and what's called mania, which are periods of high energy. Um, they may talk fast, they may move fast, they may act fast, they may act erratically, or begin to engage in very risky behavior that they wouldn't normally engage in. So it's a real contrast between the depressive periods and the manic periods, typically with bipolar disorder. Now, a discussion of mood disorders does warrant a discussion of suicide. Suicide continues to be a leading cause of disability and death, especially in adolescents and young adults. Males are more likely to end their lives through suicide compared to females. However, females do have higher rates of suicide attempts when compared to males. So how do you think it is that females can attempt more, but males have a higher rate of actual completed suicides? What do you think the difference is there? Uh-huh. So if you don't find the answer in the text, post it, post on the discussion board, and I will share that information with you based on the research. Do you know anyone who has attempted suicide? Even you yourself, possibly? Often people are unsure about how to help a friend or family member who seems to be considering suicide. There's this misconception that if you talk to someone about suicide or ask them about suicide, whether they've thought about it, that that's going to make them more likely to do it. And the research just does not bear that out. That's not true. Um, a person who wants to commit suicide, who has really thought about it, they will do it if their mind is made up. But a person who's just considering it as an escape can often be helped by a friend or family member who expresses concern for them. So it is worth your time and effort to ask that person, hey, how are you doing? Have you thought about harming yourself? So that you can intervene before that person becomes a statistic. It is okay to ask. In fact, if you are a true friend or family member, you should ask. So there are some risk factors when it comes to suicide. Um, a risk factor for completing at some point suicide is anyone who's previously attempted. So even if they've attempted once, their risk of following through and completing a suicide is higher. Having family members who attempted or completed suicide increases a person's risk. Anyone who begins to seclude themselves or decrease their level of interaction with friends and loved ones, if they refuse to participate in hobbies or things that they used to enjoy, that's a significant risk factor. Um, if they have if the person begins to give away things that are important to them, pictures, awards, valuables, anything meaningful, they start to give those things away. That is considered a really big red flag, right? So if you know someone who does that, um, definitely intervene, ask them how they're doing, get them connected with a mental health professional. The other two really big red flags that you definitely want to intervene on right away are if that person has the means, well, actually, let me do this one first. If that person has a plan, so you ask them, have you ever thought about killing yourself? And they say, yeah, I, I thought about it just the other day. And you say, well, do you have a plan? Like, do you know how you would do it? If that person can tell you that they have a plan, if they already know how they've thought enough about it to consider what they might do, and they can tell you that plan, or even if they're not willing to tell you what the plan is, but they're like, yeah, I know exactly how I would do it, that is a big red flag. Get that person to help, a mental health professional. Contact, if you're not a family member, get in touch with a family member who is willing to intervene on their behalf. Um, the other big red flag is yes, they have a plan, but also, I guess, and also, they have the means to follow through on that plan. So if they're willing to share their plan with you and they say, yeah, I would shoot myself, and they actually do have access to a gun, that's definitely a big risk factor. Or if they say, I would hang myself, they have the chair, they have the rope. Or they say, I take a bunch of pills, and there's someone in their family who keeps a lot of medications on hand. Those are the kinds of things you want to ask about. If they have the means to follow through on this plan that they have in their head, definitely a risk factor, right? Because that means that at any point they could decide to go ahead and follow through on it. So you want to get this person connected to support, someone who can intervene and remove the means to their plan, right? If they say they would use a gun, make sure they don't have access to they are not readily accessible knives, right? So you want to remove those things from their immediate environment so that they're not readily accessible. Um, There are crisis lines that you can contact as well. And just real quick, let me go ahead and throw out one of the crisis lines just so that you all will have it in case you know someone who may need it. So, general crisis line, 24 hours a day, 1-800 273 8255. 1-800-273-8255. All right. So share that with a friend if you know of someone who is at risk, or even if it's yourself, hold on to that number in case you may need it. Lastly, another category of psychological disorders that we're continuing to learn more about is schizophrenia. There is significant evidence that schizophrenia has a genetic link and can also have environmental triggers. The disorder tends to run in families. It can be a really scary, actually, disease because the person can display delusions and hallucinations. We will often have students on campus with symptoms of schizophrenia, and we'll try to direct them to various types of help. Have you ever known anybody who experienced hallucinations, delusions, right? Hearing things that aren't there or believing something that's not true? There is a percentage of people who become homeless that display classic symptoms of schizophrenia. However, more than half of the people with the disorder either will fully recover or manage the disorder with regular medication if they stay on their meds, which is really important. But schizophrenia is another one of those disorders that often is perceived inaccurately because of how it's portrayed in movies and things of that sort. So hopefully by the time you finish the psychological disorders chapter, you'll have a much better understanding of this wide range of psychological disorders or mental illnesses out there and what we know based on the research with all of these psychological disorders. So we'll stop here for the psychological disorders chapter, and I'll post a separate video for the treatments chapter. As always, if you have questions, email me, hit up the discussion board, and I will try to answer those questions as quickly as I can.